Good morning, everybody. My name is Christoph Seitz. I'm from Switzerland, talking about healthcare today as an assignment for the summer school in The Hague. The healthcare system in Switzerland is very complicated as there are players on the private level, public level, state level, and it's very difficult to have an overview. And of course, like in every country in the world, there are daunting challenges also for our healthcare system. But then, in general, I'm quite happy how it works. Life expectancy in Switzerland is the highest in the world, right after Japan. Infant mortality is very low. Cancer treatment, diabetes treatment is very good in Switzerland. So we have to ask ourselves the question, what can be improved? And one thing that is always on the mind of people in Switzerland are the costs of the healthcare system. They have exploded over the last 20 or 30 years as drugs have become more expensive, more personnel is required, very expensive equipment is required, and it has been very high also on an OECD level with roughly 10% of Swiss GDP. As Swiss GDP is very high, this is the third highest spending for healthcare in the world, right after the US and Norway. One factor is containing this cost explosion is the self-responsibility that is implanted in this system. This is on the health insurer side. We have different packages where the private patients pay for the first, say, 1,000 or 2,000 francs by themselves. In my case, it's the first 2,500 francs. So if I go to a general practitioner, I know that I will have to pay for some of the costs. And this, of course, is then a typical patient run in Switzerland. You first ask yourself, do I actually have to go to a practitioner, or should I go to the drugstore nearby and ask for a drug which can cure me, for example? If it doesn't work, I go to the general practitioner. He tells me, oh, it's too difficult, you have to go to the specialist, and then the specialist gives me the appropriate treatment, which is very costly and which then is covered mostly by the health insurer. I like this element of self-responsibility in the system because it makes you think what you need and what you don't actually need. But then it's also a weakness because maybe sometimes you don't go to the doctor as quickly as you should. And with e-health, for example, this could be improved with telemedicine, where I could talk to a doctor on Skype and get some first advice, or with health monitoring, let's say with smartwatches, or in the case of diabetics with the monitoring of glucose levels. So I think in the field of e-health, Switzerland can still do a lot. Also in the field of prevention of diseases, Switzerland is not one of the leading countries in the world. But in general, I have to say that the quality in the service level of the health system in Switzerland is very high. That Switzerland often is a role model for other countries when they adopt a more self-responsible health system, and I'm quite happy how it works. I hope I don't have to have an operation, but if I have one, I'm sure in Switzerland, and I'm one of the 99.5% of the population who has actually a health insurance that covers at least 90% of the cost of it. So thank you very much for your attention. I'm looking forward to The Hague and see you up there.